Dr. Mudit Khanna, Senior Consultant Joint Replacement Surgeon at the South Mumbai unit of Wockhardt Hospitals. I have special interest in performing joint replacement surgeries, especially with the use of technology, both robotics and navigation, as well as performing these procedures with minimally invasive approaches to enhance the patient's experience and the recovery process.
What is arthritis?
Okay, so that's a very good question. So, what is arthritis? Now, arthritis can broadly be divided into osteoarthritis and inflammatory arthritis like rheumatoid arthritis. Arthritis का basic मतलब ये है कि जहाँ पे भी दो bones आपस में मिलती हैं, वहाँ एक layer of cushion या layer of cartilage होता है उन दोनों bones के बीच में. The loss of this layer of cushion or the loss of this layer of cartilage between the two bones that make up a joint is known as arthritis. Osteoarthritis means arthritis जो wear and tear process की वजह से हुई हो, which means with, let's say, with aging, with wear and tear of the joint, something goes bad, that is osteoarthritis. If there is a disease that attacks the cartilage and makes it go bad, that is an inflammatory arthritis like rheumatoid arthritis, gouty arthritis. But arthritis in the most simple terms means loss of cushion or cartilage between two intervening bones that make up a joint.
What are the early signs of arthritis that people should be aware of, and how can early diagnosis improve long-term outcomes?
Okay, so what are the early signs of arthritis? Arthritis जब शुरू होती है तो सबसे पहला symptom usually ये होता है कि जब एक patient for a long time when they're sitting on a chair, let's say they're sitting on a dining table, और फिर वो खड़े होते हैं और चलना शुरू करते हैं, तो पहले 4-5 कदम लंगड़ाना पड़ता है. They limp for the first few steps and then they feel they are okay. If they have to go up or down the stairs, there is a bit of pain when they're trying to navigate the stairs. If they sit in a car for a long time, getting in and out of the car feels difficult, but once they start moving, they become reasonably okay. So early signs of arthritis typically present with stiffness around the joint after a period of prolonged immobilization.
With advancement in medical technology, what are some of the latest treatment options available for arthritis, especially for those in advanced stages?
Okay, so again, this makes the question a bit easier. We have to divide treatment of arthritis into treatment in the early stages and treatment into advanced stages. Now, what is an advanced stage of arthritis? An advanced stage of arthritis is when the cartilage is almost completely or completely worn out, which means the cushion or the cartilage is completely lost and the bone at the top is grinding against the bone at the bottom. Now, once someone has grade 4 arthritis or bone on bone arthritis, the only option available is some form of replacement surgery. Now, what I mean by some form of replacement surgery is that the knee essentially has 3 compartments: the inner compartment, the outer compartment, and the front compartment. If only one compartment is involved, they can have a partial knee replacement or a partial knee resurfacing procedure. But if more than 2 compartments are involved, or if their ligaments are also damaged, they may need a total knee replacement. In terms of what the latest advancements in partial knee replacement and total knee replacement is concerned, is that we now have the capability of performing the procedure with robotic assistance, which means that we can be very, very precise, very, very accurate, significantly more safe, and we can provide a procedure which is much more personalized based on the patient's anatomy of the knee rather than being more generic.
Can lifestyle changes such as diet and exercise significantly impact arthritis management? And if so, what specific recommendation do you have for patients?
So whenever we look at arthritis, we've got to look at risk factors that are modifiable and risk factors that we cannot modify. Now, what are the risk factors that we cannot modify? We cannot modify our genetic predisposition to have arthritis. So if our parents had arthritis, it is quite likely that we will get arthritis despite whether we control our weight or we do our exercises, etc. or not. However, modifiable risk factors, if there's one thing that you can change or to reduce the chances of developing arthritis, then that is your body weight. Weight plays the most significant role in the progression of arthritis. When a patient is on a single leg stance while going up or down the stairs, it's 8 times the body weight that acts across the joint. So if someone is overweight by 1 kg, there is 8 kgs of stress extra acting on the knee. If someone is 5 kgs overweight, it would mean about 40 kgs of weight is adding stress across the knee. And imagine someone who's overweight by 10 kgs or 20 kgs, you're talking about 80 kgs, 160 kgs of stress. So yes, the single most important modifiable risk factor or avoiding the need of a surgery or avoiding the need of a replacement is maintaining ideal body weight. The second most important modifiable factor is exercise or activity. Arthritis is a stiffening condition. It is a condition that is trying to jam up our joints. It is a condition that tries to stiffen up our joints. So what can we do? We can make sure that we keep our joints mobile, moving, active, and not let it stiffen up. So we don't want to lose our range of motion within the joint because that significantly impacts function, and once function is significantly impacted, we may end up needing a surgery much sooner than if our function was not impacted. So weight loss and exercise, these are the two most important modifiable risk factors and significantly important in delaying the need of a knee replacement surgery.
What role do minimal invasive surgical techniques play in arthritis treatment, and how do they compare to traditional joint replacement surgeries?
Yeah, so another important question, as I mentioned right in the beginning, is that I have special interest in minimally invasive joint replacement procedures. So what is minimally invasive in a joint replacement surgery? Now, minimally invasive in a joint replacement surgery essentially means how we approach the joint. So we can get to the joint to perform a knee replacement by cutting the muscle right in the center and opening the joint up, or we could just take the muscle all the way to one side, perform the surgery, and then let it fall back into its place. If we choose the latter option, since we have not cut the muscle, we don't have to wait for the muscle to heal before it starts functioning adequately again. So minimally invasive approaches, minimally invasive procedures where you do not really cut through the muscle but get the muscle to the side and perform the surgery, patients have a much faster recovery, much rapid recovery. They're able to walk from day one, they're able to do a straight leg raise from the day of surgery, and they have significantly lesser pain and better function when you look at them at 6 weeks, up to 6 weeks. At 6 months, probably there's no significant difference whether they had a minimally invasive approach or they had a sort of more invasive approach. But yes, minimally invasive approaches make the first few weeks of surgery much more comfortable for a patient.
How do you approach pain management for arthritis patients, especially those who may not be ideal candidate for surgery?
So there are a few things that we need to understand, that arthritis is kind of an end stage disease, and the permanent solution to the problem of arthritis only and only lies in a knee replacement surgery. But if we are faced with a situation that a patient is not fit for a surgical procedures, we have multiple options to try and offer them pain relief. One of them is an intra-articular injection. Now we can inject different things into the knee, and the options that are available to us are injection of steroids, which is an effective painkiller. A lot of patients are scared and do not want to have steroids injected into the knee, but if we talk about all existing guidelines, then all existing guidelines recommend that intra-articular injection of a steroid is a safe intervention and a very effective intervention to reduce pain in a patient suffering from osteoarthritis. Yes, but we do not want to give this steroid systemically, which essentially means we don't want to give tablets of steroids or an intravenous injection of steroid or an intramuscular injection of steroid. Steroid injection for osteoarthritis is limited to an injection of steroid inside the joint. Other than that, we have regenerative approaches for patients who are in early stages of arthritis, where we can inject growth factor concentrates, platelet-rich plasma, bone marrow concentrates. All of these are aimed at regenerating cartilage and help reduce the progression of arthritis. The last but not the least, another form of injection known as hyaluronic acid or viscosupplementation is where you inject a gel, a thick viscous liquid into the joint, and again with the intent of providing the joint or provide the aging osteoarthritic cartilage with hyaluronic acid, something that it is deficient in, and provide lubrication to the joint at the same time. Now, other than injections, there is a new intervention that is available, which is called radiofrequency ablation of the genicular nerves. So what you do there is you basically approach the nerves that carry pain to the joint, and you kind of numb the nerves that carry pain to the joint, and therefore while the joint keeps going bad, the patient does not experience pain and therefore achieves a significant amount of improvement in pain and function.
Can you discuss the potential of regenerative medicine such as stem cell therapy or platelet-rich plasma in treating arthritis?
So I already mentioned this as one of the options that are available when we're talking about early stages of arthritis. So yes, I think we need to divide arthritis into early degrees of arthritis and advanced stages of arthritis. When a patient presents to us with early stages of arthritis, a primary objective is to delay the progression of arthritis. Now, where we intend to delay the progression of arthritis, we always try and focus on more regenerative approaches that can potentially reduce the rate of wear and tear and thereby preserve the cartilage for a longer time. And this is exactly where growth factor concentrates, platelet-rich plasma, bone marrow concentrate that is rich in stem cells come into play. These are potentially regenerative therapies that could, in theory, delay the need of a knee replacement and probably prevent the need of a knee replacement in a small subset of patients.
Okay, last question. What advice would you give to someone newly diagnosed with arthritis in terms of both managing their condition and maintaining their quality of life?
So if you've just been diagnosed with arthritis, remember that the most important advice that I would want to give is that remember that the treatment is in your own hands. It is not in the hands of the surgeon that you are visiting. If there's one thing you can make sure to delay the progression of arthritis, that would be to maintain an ideal body weight. If there are two things you can do to prevent or delay the progression of arthritis, then it would be one, to maintain a healthy body weight, and two, to make sure you do good physiotherapy, range of motion exercises around the knee, walking, cycling, swimming, elliptical. All of these activities do not make your joints worse. They are joint friendly exercises that keep the joint mobile and moving. So please keep moving, keep making sure that you maintain an ideal body weight and you keep doing exercises so that the joint stays mobile and active. One of the examples that we quote is that arthritic joint is like an old car. If you keep driving the car, it will keep running. If you park an old car, it's probably not going to work any longer. So please stay active, keep your joint moving, make sure you maintain a healthy body weight, and if symptoms still continue to sort of trouble you, then come and see an orthopedic surgeon who might be able to help you out with other modalities of treatment.